Welcome to the presentation on the ethics of gifts in psychotherapy, social work, counseling, and marriage and family therapy. I'm Ofer, PhD, a licensed psychologist, ethicist, instructor, expert witness, author, and most important for me is I'm anthropologically critical thinker. In addition to my dozens of published articles, APA books have also published my book on boundaries in therapy, which include a chapter on the topic we are going to discuss today, the ethics of gifts. A good place to start this presentation on gifts is to share with you that I come from a strong gift-giving culture in the Middle East, from Israel. When I come back from my many visits in Israel in the last 40 plus years, I usually bring back with me like water from the Jordan River for where Jesus was baptized to my Christian clients, and they sure appreciate it. Then I also bring rocks from Jerusalem to my Muslim or Jewish clients, and they equally appreciate it. So what do we know about gifts? Gifts are an ancient and universal expression of gratitude, appreciation, altruism, and love. Gifts are generally bestowed voluntarily without compensation. There is a limited attention in the professional literature about gift despite the common occurrence of gift in therapy. In recent years, we see there's a growing willingness to discuss gift in a more nuanced manner in the field of ethic of psychotherapy. Therapist roles is generally just express appreciation to clients' appropriate gift and in necessary explore the meaning, and as well as handle inappropriate gifts that we'll talk about it in a minute. Challenge in responding to gift is primarily is around inappropriate gift, ill-timed gift, excessive gift, or super expensive gift. So there are several types of gift in therapy. Gift given by therapist or given by client, symbolic gift, concrete, modest, or extravagant gift, examples of homemade goods, music CDs, opera ticket, or even like cars. And we'll talk about it in a minute. Inappropriate gifts are super expensive or those with romantic, sexual, or violent themes in them. A gift can also serve as transitional object, like if I do give something from my office that the client can hold on, and when anxious or when depressed or when frightened can hold on to and use it in order to recalibrate oneself. It's also therapist is a form of therapist self-disclosure. When I bring something from Israel, they know where I come from, and I explain that I went to the Jordan River. Extra time and physical touch. So all these are relevant. Concern with gifts include gifts that respond to referrals, like that we give response with a gift to somebody who gave us referral. It's unethical conduct and potential conflict of interest. So watch out when you get gift, when you refer somebody, or when you think about giving gift to somebody who refers somebody to you. Influence on prescribing behavior, which is relevant to psychiatrists and to some psychologists, is a conflict of interest. So limit gift value and require disclosure when you do acknowledge or give gift to as part of prescribing behavior. Gift and boundaries, beside gift, boundaries include self-disclosure, physical touch, bartering, fees, and I have a whole YouTube on this topic. Appropriate gifts are boundary crossing. Inappropriate gifts are boundary violation. Gifts given by clients, it's something really important to watch for. Not so most therapists accept small symbolic gift from clients positively around the holidays or termination, after challenging emotional situations, or gift from children who give you a nice painting or something. So the benefits is viewed as enhancing therapeutic alliance when we accept appropriate gift and give appropriate gift and tie to positive clinical outcome. Concern, again, is excessive gift, high monetary value, or inappropriate, violent slash sexual or racial themes in the gift. Then we need to watch with our client when there is a kind of try, quote, to buy love through giving gifts. Clients seeking therapy due to feeling unappreciated may resort to gift giving to seek love or to seek approval. And that's something for therapists to pay attention. And the challenge is how to identify the patterns and to address them constructively without kind of shaming the clients or without causing the clients that feeling of rejection when you didn't just accept the gift, but you're ready to talk about it. So refusing client gifts obviously can make the client feel rejected and can harm the therapeutic alliance. So explore the client motivation in an empathetic way of discussing it. So sometimes paradoxically, gift can be expression of negative feelings. So if somebody try to counter the negative feeling, a patient, and give you a gift to try to do good as a overcoming or countering. Explores the potential negative feeling also in a clinical, sensitive, appropriate manner. Expensive gifts from wealthy clients are, I lived in Northern California and I was offered valuable stock tips, extravagant gift like a car. And when somebody also gave me like super expensive jewelry or something, I just put it on a chair or in a little thing in between us and talked about it. And it was there for weeks between us to talk about how to use gifts in order to buy love. So it was kind of we use it in therapeutic manner. I didn't reject it, but I didn't take it in. But it was something to talk about it. Primarily with wealthy clients that they do have awareness of their wealth on others. So sometimes putting the gifts in between us and reflecting on that, the client doesn't experience rejection, and we get a chance to talk about the meaning of the gift and how do they use gift into interpersonal relationship. Briefly on the Code of Ethics of Gift, there is no code of ethics or guideline in a major organization that specifically ban gift in therapy. Again, no code of ethics or guidelines in a major organization, professional organization, that specifically ban gift in therapy. So if you go to a risk management workshop and it tells you no gift, no touch, no this and no that, it's not bound in the Code of Ethics or in the way we conduct ourselves in therapy, the standard of care. None of the major U.S. professional organizations, some APA, American Psychiatric Association, CAMFT, NASW, NBCC, Code of Ethics even mention the topic of gift. So whenever you go to the workshop, just treat it kind of as a risk management, not necessarily as a standard of care. Instead, the codes do have the standard mandate to avoid harm, of course, in general, and exploitation, and to respect clients' integrity, autonomy, privacy, and perhaps what I've been emphasized in many of my presentation, culture. AAMFT, for example, Code of Ethics, mentioned the term gift in which it states, quote, marriage and family therapists pursue knowledge of the new development and maintain their competence in marriage family therapy through education, training, or supervised experience. So they just say, pay attention. NAADAC and ADAC Code of Ethics include the following about gift. In addition, professional avoid situations that might appear to be or could be interpreted as conflict of interest. Gift over $25 will not be accepted under any circumstances. Why $25? I have no idea, but what I think they're telling us is there is financial component, and this is correct. ACA, Code of Ethics, take a flexible, appropriate stance on gifts, and is the ethics code of ACA, quote, receiving gifts, counselor understands the challenges of accepting gifts from clients and recognize that in some cultures, small gifts are token of respect and gratitude. Beautifully said. When determining whether to accept a gift from client, counselor take into consideration therapeutic relationship, monetary value of the gift, as we mentioned earlier, the client motivation for giving the gift, and the counselor's motivation for wanting to accept the gift or decline the gift. So there's kind of a pretty good guidelines here by ACA. A licensing board and ethics committee often frown upon therapists receiving financial or stock investment tip, and this is actually pretty appropriate. The concern is that the therapist may be using their influence to obtain information and the potential illegality of getting insider information from our client. Similar to this concern is sometimes when the clients leave present for us or houses for us or lots of money for us in their wills. So the complexity in handling gift made through bequest, especially after the client death, you need to be really, really careful. And sometimes I negotiate it with the clients that if they want to give me something, I don't want to take it, but they can give it anonymously to some mutually agreed upon charity. So I didn't get anything from them, but upon their death, there was some anonymous donation. I was informed of financially significant interferences from my ex-client, and so he left me a large sum of money, and I chose not to accept it. Just not even try to negotiate with people who handle the inheritance. Were to this. So consideration of the potential effect of the gift on the client's family members is very important. And sometimes it's easy when it comes to kind of bequests and wills, there's a lot of tension in families, and they can lead to lawsuits. So consult, and if you can give it, I sometimes didn't accept it, or sometimes I negotiate with a client how to give it to a third party that can use the money. It's important for us to consider the timing of gifts and appropriateness. So unexpected gift during the holidays is normal. Termination, nice simple gifts are good in both ways and are generally appropriate. Ethical and clinical quandaries with expensive gift, as in the last session or after termination, as I mentioned earlier, you need to be very careful with that. Get consultation, sometimes give it to a third party or don't take it at all. Gift in therapy must be definitely understood within the cultural context. And, some of our clients coming from cultures where rejecting their gifts will be rejecting them, and it will be perceived as highly disrespectful and it'll be harmful for the therapeutic exchange. So definitely pay attention to culture. Us giving gifts to clients, so we need to think what kind of gift we give to clients. I mentioned before that I bring water from the Jordan River, or so the gift from therapists to clients can be symbolic, it can be transitional object I mentioned earlier, clinical aid, affirming the relationship between us and our clients, and of course consider cultural sensitivity when giving gift, your own culture and their culture. So in summary, gracious acceptance of appropriate gift to avoid rupture in the will avoid rupture in the therapeutic alliance. So sometimes you just need to say thank you. Important of exploring the meaning of the gifts only when necessary. If you're psychodynamic, you may do it more often because it's part of the theoretic orientation, but for most other orientations, sometimes just saying thank you will be good enough. Inappropriate gift must be attended to ethically, legally, and clinically in appropriate ways, as I mentioned earlier, whether it's expensive or it's sexual or violent or racist kind of a gift. Some setting like prison, jails, or school may have a specific guidelines in regard to gifts. Like when I work in the prison, any gift that they gave me really belonged to the prison, not to me. And if it was a drawing or a picture, I just put it on the wall. If it's something else, I give it to my superior. So if you're working in setting like prison, jail, schools, police, whatever it is, so pay attention to that. And finally, again and again, acknowledgement of the culture component of the gift giving is extremely important. If you don't really understand the culture within the client giving the gift, you can miss the connection with the client and the meaning of the gift and lose kind of the therapeutic alliance. So good luck to you, and looking forward to meeting you all in my next YouTube recording. Thank you.